Hi everyone, my name is Michael Fensky, and my clinical question of interest is how can nurses help patients with congestive heart failure have better quality of life? I think this is an important question to address because heart failure is a very debilitating chronic disease and is known to be a common ultimate path for cardiac disorders. These patients commonly experience symptoms like dyspnea, fatigue, sleep disturbances, and depression. And this in turn leads patients to limit their physical and social activity, resulting in dependence on others for self care needs, social isolation, and an overall decrease in motivation and interest in the quality of their life. Heart failure is also among the most common chronic diseases requiring readmission, and this can be not only an enormous strain financially, physically, and mentally on the patient, but also on the healthcare system. My initial concept map shows the contributing factors that affect quality of life in patients with heart failure. They include non adherence to lifestyle modifications, lack of effective stress management, inability to get proper rest and sleep, sodium and fluid intake, and the psychological implications and feelings of hopelessness associated with heart failure. This preliminary concept map goes beyond the physical symptoms and trickles down into most everything the patient does in their day to day life. So I used Roy's adaptation theory to address the clinical question. Briefly explaining the theory, the adaptive system in this case is the individual who is presumed by Roy to be capable of coping processes to maintain adaptation and promote person and environment transformation. The environmental stimuli include focal or physiological stimuli, contextual, which contribute to the focal stimuli and have an impact on ability to adapt, and residual stimuli, which can include beliefs or attitudes that may shape the responses to the focal and contextual stimuli. The coping processes, regulator and cognator, reflect the coping measures to focal and contextual/residual stimuli, respectively. These coping processes are manifested in the four different adaptive modes: physiologic, which maintains physiologic integrity; self concept, which maintains psychological and spiritual integrity; role function, which focuses on fulfilling roles in society; and interdependence, which focuses on giving and receiving love and respect and value to others. This is an appropriate theory to help address the clinical question because it focuses on adapting the patient's responses to physical, social, and emotional challenges experienced when living with heart failure, especially considering that much of the treatment of heart failure consists of lifestyle adjustments in adjunct with medication. So my updated map is derived from Roy's adaptation model, and I put a spin on it to relate to my clinical question of how nurses can help patients with congestive heart failure have better quality of life. Beginning with management of stimuli, the nurse and patient work together to identify specific factors that impact that patient's quality of life with heart failure. Moving to environmental stimuli, this more so entails managing the signs and symptoms of heart failure, as well as role changes and willingness to accept and ask for help, and tactics such as motivational interviewing to help elicit change in the patient. Coping processes can help patients form skills to manage the stressors of living with heart failure more effectively, and can focus on both regulator processes to deal with the physiological signs of heart failure, as well as cognator processes, such as easing anxiety about the treatment regimen created. Adaptive modes and adaptation level are the ultimate goals that will be the main follow-up points between the patient and the nurse in practice. The anticipated outcome from applying Roy's adaptation model is the patient making strides toward achieving the four adaptive modes to improve their quality of life in all facets, and the nurse should evaluate the adaptation level throughout the process to make adjustments as necessary. So what can you take away from learning about Roy's theory that you can use to help your patients? By utilizing Roy's theory, you can get a better understanding of the difficulties patients face in staying healthy in all cases. Utilizing Roy's theory should involve a thorough interview with the patient to understand their specific case. Health goes far beyond just taking pills, eating and exercising well, and utilizing Roy's theory can help the nurse understand the broader picture of a patient's health and implement adaptation interventions to improve patient outcomes.